So I think this is a very good question. And, we all come here, we, take a trip from India, we are going through a lot of struggles to get a US clinical rotation. So it's very important that we impress while we are on the rotation, because that's the whole goal of being on this rotation. So to start off with, whatever you're getting into, I would say start off with just going over the basics, how to take a good history, right? How to write a progress note, right? So don't go into like, a state of the art. If I'm doing a rotation in cardiology, should I know how to manage, complicated medical conditions? No. Just start with how do you get a basic history? How do you write a progress note? How you review the chart in the morning? How you present the patient to the attending in the morning. And I think, Pawan, maybe it would be a good idea to actually have a 30 or 40-minute seminar where we just tell them how to write a progress note, how to write an HMP, how to do a review of systems, how to write a physical exam, how to write an assessment and plan. So you want to start with that. You don't want to be talking about, state papers just come out right off the bat and things like that. But as long as you can start off with just going over the basics well, where they feel like you fit into the team very easily, and not where they kind of have to keep guiding you through the process. So I think that's important. I think besides that, it's very important to create a good relationship with everyone on the team. So if you're rotating with me, you'll have a fellow from either MD Anderson or the University of Texas. You'll have residents and you'll have medical students, right? So it's very important to get along very well with everyone on the team, because typically when I'm writing a letter of recommendation, I'll ask the fellow, the resident, like, how was so and so's performance? And if they say, no, he was great, he really helped out, and he was there right through the rotation, that kind of looks nice, and I'll definitely, mention that on the letter of recommendation. So make sure you try and get along well with everyone on the team. And the easiest way to do that is to ask someone, can I help you? Are you busy? Is there something I can do for you? Just making that, putting that statement across and just doing something basic for the team makes a big difference. I'll give you an example. For example, you're taking on hematology and oncology, and we discuss at rounds that we want to check, we think the patient has hemolytic anemia, we are checking a haptoglobin and a retic count, right? So what you could do is you can go and tell the resident that, I'll go and tell the nurse to go and draw the haptoglobin and retic count. And when the labs come back 2 hours later, I will follow up on that lab and I'll let you know what the lab was. So you're taking full ownership. You go and tell the nurse, you put in these labs. Can you please draw these labs? You check the system 2 hours later, say the lab has come back. You go back to the resident and say, for so-and-so patients, the labs have come back and the haptoglobin was normal or whatever. Those are things that really, really show that you are very involved in the rotation. You're looking to help and you're looking to be part of the team. You're not just finishing with rounds and then saying your responsibility ends, but it shows you actually are following through on what was discussed at rounds and making sure you finish your work for the day.
Thank you so much for watching. We hope that video provided valuable insights for your journey. Don't forget to subscribe to our YouTube channel and follow us on Instagram and Twitter. And check out our website for details on how we can guide you to a successful match.